welcome to the Future of Virtual Pediatric Care webinar. We'll be sharing some great insights from the 2021 State of Pediatric Telemedicine Survey with three phenomenal panelists. I'll start with Mick Connors. He is a pediatrician and a serial innovator. He serves as a leader at Anytime Pediatrics as the Chief Executive Officer and a co-founder here at Anytime Pediatrics. Also from the Anytime team, we have Garrison Hogan. He is a talented marketing analyst and has played a key role in driving meaningful insights and correlation in the data that came out of the 2021 State of Pediatric Telemedicine Survey. Last but certainly not least, we are so glad to have Marian Temesvary. She is the Chief Strategy Officer at Health Mavens, and Health Mavens is the third party who conducted this study, the 2021 State of Pediatric Telemedicine Survey. She is a researcher and observer by nature and has built a career that really focuses on making sure the needs, voices, and expectations of all are heard and fully represented. We're really grateful to have Marian join us today to share her expertise. We will get started with Dr. Mick Connors. Hi, Dr. Connors.
Hey, Tencel, how are you today? Thanks as always for organizing us. So I just wanted to welcome everybody, and I'm very excited about the information that we'll share with you today. We'll also share the full report at the end that you can download and link to. So the purpose around this study for us, for me especially, was to really use an independent third party to assess where pediatricians were currently in telehealth. So this was a broad-based study. They'll talk about the overall results. Look forward to kind of going through the data with you. 92% of the clinicians believe patients will expect virtual care as part of their health care. That's a pretty remarkable number that stood out to me as part of this, because I can tell you from an Anytime Pediatric standpoint, we did a survey last March where pre-COVID about 10% of pediatricians were utilizing telemedicine or thought it would be part of their practice. And we did it about a month later, and it was this number, and this number seems like it's going to stay pretty strong, that 90% or more of clinicians believe that this is an expectation.
We had incredibly high rates of writing comments. So everybody who responded is very engaged in the topic of telemedicine, has some pretty passionate and strong opinions about it. I think you would agree, Garrison. There was nothing neutral in the findings that we had. The majority were MDs, 80% were MDs, practice owners, partners, or associates. And also a little bit interesting is that the age group was, the largest portion of the age group was over 45 years. Some of the comments that we received, we just want to share one comment with you. This is one of many that underscores what Mick said in the beginning, which is this idea that there's an expectation that not just physicians or not just pediatricians have an expectation that it's going to continue, but they feel their patients do as well. It's the future of medicine. It's convenient. After office hours, it's useful. Incorporating it as ongoing care, incorporating exam tools and things like that. So we saw many comments like this in the study. There were a few, potentially we could call them surprises. So we know that doctors say patients expect it, and yet they say at the same time that patient demand is what would make them want to use it for more. And what this basically told us was that pediatricians are going to be very comfortable using this and adopting it more if their patients are happy and their patients are using it and they're seeing demand for it. I think there were some people who told us that they're not 100% comfortable that telemedicine is appropriate in pediatrics, but at the same time, if their patients are comfortable using it, they are going to use it and they will use it more. There are still some hurdles in terms of the payments, even though most states are paying for it. Again, one of the things that we heard, there's a little bit of disconnect because there's a lot of inconsistency, and pediatricians are not all seeing consistency and universal reimbursement for telehealth. And then connectivity is a big role. This is one of those situations where there are certain aspects of this that the telemedicine provider certainly cannot controlled. So your AT&T Wi-Fi connection is not something that the telemedicine provider can control. So there's really sort of this situation where we're hearing from a lot of pediatricians that connectivity is a very big issue, and it continues to be a big issue. And that level of reliability and just consistency comes through in how they view telemedicine. It's part of the perceptions that we saw, certainly.
Yeah, so along with what Marian was talking about, there was a lot of rich data in this survey, but the write-in comments kind of provided color to all the data that we found, and these are just kind of some examples of some of the themes around the write-in comments and supporting the data that we found. Kind of talking about, for instance, mental health services. We're a leading use of telemedicine kind of across the board, kind of like you see in this first write-in comment. And then talking about the telemedicine using your platform more if it can mimic the in-person visit workflow with the staff handoffs. And then we kind of got into the there were a lot of write-in comments around kind of age and viewing that as a barrier. But when we kind of dove into the data, that it didn't really pan out in terms of utilization of telemedicine. It seemed to just kind of be the perception that existed, but didn't really correlate to actually utilization rates across demographics.
There were some common themes, certainly, that we were seeing. Visit types typically were behavioral health, sick visits, follow-ups. The adoption, again, I spoke to connectivity already, but this idea of understanding the need from patients and also the idea of reimbursement really affected telehealth adoption by the pediatricians who responded. And when we looked at the top tech used in 2021, EHR was certainly the number one. Telemedicine was a very close second, and patient portals was the third that pediatricians told us they were using. The interesting thing about this idea, the mental health services and dietary consultations, you'll see in a little bit later in the presentation, we talk about the length of visits, which for us certainly was a little bit surprising because they were longer than I would have expected. But that correlates back to the type of visits that we're seeing, which certainly are all over the board. They're not as simple as, oh, I'm just going to check in on a prescription. They're actually very how shall I say, useful visits, and they're on all kinds of different things that need to be taken care of. There was a sense that when telemedicine hours are separated from the regular physician's hours, it works better. So in other words, let's focus X number of hours a week on telemedicine specifically, and there seems to be some efficiency to that. Additionally, the idea that if you have a larger clinic, perhaps you have some providers that are just doing telemedicine. We heard that from a couple of people too. And then this last quote really resonated with us, this idea that this wasn't certainly the only quote like this, but we pulled this one out, that we keep people out of the ER. There's some triage going on. It's helping clinicians to manage patient needs even when they can't see them in person.
This highlights kind of the visit trends that we found in the data, between just the frequency of visits per week, along with the duration of those visits, and then getting to when they were offered by the respondents at the practices that they were a part of. So starting on the left, the average weekly visits, you'll kind of see that they're bookended. So there was a lot of disparity between low utilizers and then high utilizers, with 29% being between 0 and 5 telemedicine visits per week per clinician at the practice. And then there was 1/4 of the respondents reported doing 20 plus visits per week. And then the rest just kind of falling in the middle. So it was kind of interesting to see how much disparity there was between respondents, even when a lot of the, like I had mentioned, demographic results were kind of similar. And then in the middle, we got into the duration and looking at the average length of the visits. The the bulk being between 10 and 20 minutes. And this had the strongest correlation, the duration, obviously, with the use case. Behavioral health by far and away were the longest visits, with almost all of those being 20 plus minutes. And then interestingly, the shortest visits were the sick visits, with the bulk of those being under 10 minutes. And then we also examined, when practices are offering and available to patients for telemedicine visits. 96% offered it during regular office hours for scheduled visits, with about 1/3 offering it during the after hours on weekdays and then also on weekends. We also found that the availability correlated strongly with the average weekly telemedicine visits. So the groups that were offering the after hours on the weekdays, in addition to just scheduled visits, reported a much higher rate of total visits throughout the week than people just doing scheduled visits.
Yeah, so that's a good preliminary data. Garrison and Marian, what did you find that clinicians are specifically looking for? I know you went into some deeper detail, along with that high level data. Did you drill down into kind of what the clinicians were exactly after with telemedicine or virtual care?
Yeah, certainly we did. And there were a lot of differing viewpoints, if you will, in terms of what was needed, but there were some things that were pretty universal. More robust integrations, perhaps integrations isn't the right word, functionality of the integration with EMR. So this idea that clinicians told us, make my charting easier. Don't make me have to use two screens. Let me upload photos and videos directly and make it seamless between the two. So how can the integration with the EHR really be much more seamless and mimic what a physician would be doing in an in-person type of visit? So that would be one. Intuitive workflows was a big one that came through quite often. And I think along with that, the other area that came up, and we certainly saw a demand for integration with other technologies. So otoscopes would be one example. So those are the kinds of things that came through when we asked those kinds of questions, Mick.
Right, yeah.
Here, this is, yeah, this is just a little bit of a visualization of that. This is like, the EHR integration should go beyond the basics, obviously, but virtual check-in processes, easy payment options, live interpreters in the visit, that came up with a number of people, a Spanish version to serve more patients. And as I said earlier, integration with devices.
And so this was really across all survey users, right? They were all commenting on those kind of things.
Mm-hmm. Yep. Yes, they may have different subsets. There was no statistical correlation, but different subsets may have put them in different orders of priority. But those were certainly the top 4 or 5 things that floated to the top for everyone. So one of the sort of summarizing a little bit, what we've been talking about, these were direct writing comments as well, that 91% of the respondents said that insurance companies really need to be at the same rate as in-person visits. I would add the postscript to that is just consistency in how insurance companies are reimbursing for telemedicine is a big desire and need. This was a little bit of a surprise for us at Health Mavens, was the sense that pediatricians are starting to see the value of this. They really believe that it can increase the number of visits to the practice, which is a really powerful thing when you think about it, because everybody, from a business standpoint, this has an implication for future opportunity. 78% of them believe that telemedicine should integrate with the stethoscopes and the otoscopes. That's not really a surprise. And 60% of the respondents said their patients prefer to access telemedicine on an app, but overwhelmingly the clinicians themselves prefer the computer, or use the computer, if you will.
So we have another write-in comment, kind of going along with what Marian said. And, we found a lot in the Reddit comments of just clinicians really wanting a way to provide integrations and functionality that mimic like a true in-office visit, and really making the platform they're using a true virtual care platform, and that would help drive the utilization of telemedicine. So this comment right here talking about stethoscopes and otoscopes, like the need for them and how, you know, pediatric clinicians always listen to the heart and lungs, and that's, you know, such a huge part of their job, and that will kind of be something somewhat of a barrier in regards to telemedicine without the ability to, you know, just get the basic vitals of the child in a virtual care visit. So, you know, in the future, providing that ability to do that will, I think, go a long ways with the clinician comfort in terms of adoption and using it to telemedicine's full potential.
Yeah, and I know you guys dove into this as well, kind of, you know, the barriers of clinician utilization, and that's something that, you know, we at Anytime Pediatrics are always looking at is how can we overcome the barriers to adoption for the clinicians, and kind of what's holding them back, or what kind of things are they looking for? Can you guys elaborate on that from the study?
Well, as we've said before, Mick, certainly some of the things that are out of your control, right, that are the reimbursement and the connectivity, but the things that the telemedicine provider does have some control with, obviously EHR synergy, this ability, or the fact that people are seeing the opportunity for revenue growth, integration with peripheral devices, mimicking in-office workflows, and the synergy with EHR. Again, I know it sounds a bit repetitive, but it's like, when you do a study like this, you ask similar questions in different ways to test for the veracity of the data. And the same things came up over and over and over again, and they were pretty consistent. But I would also say that those are the objective things. I think subjectively what came through to us was this sense that pediatricians really want to be able to trust that they can practice good medicine with virtual care.
Nice. And then those barriers, you want to go back to that last slide, Tencel? Because I think this is a good, these are things that certainly I hear all the time, is kind of, you know, this magic wand of connectivity, and is that getting better or worse, or how does that vary? And then insurance reimbursement or payment, or, you know, kind of a lot of, everyone's kind of getting paid now, but you still saw that as a barrier to utilization reported by pediatricians.
Yes, definitely. Yes, we did.
Yeah.
Across the board.
Yeah.
Okay, great. So I know Garrison mentioned this before, but one of the common things too, we often hear that age is a factor. That the, you know, younger clinicians are going to do more of this because they're more tech savvy. The older clinicians are not, or vice versa. I hear a little bit from everyone, depending on, I think, their bias around virtual care and telemedicine. So I know you guys dug in. What did you find around age? Was that an influencer related to technology adoption?
Yeah, so we, like I'd mentioned a little earlier, we really dug into this with the data, and 72% of the respondents were over the age of 45. Like we said, we had just about 800 responses, and then additionally, 43% were over the age of 55. So, and then when we really kind of tease that out, there were no significant differences in terms of telemedicine utilization within the practice from those respondents. And also, there was no correlation with age to the types of technologies that they're using in their practice, whether that's like a patient portal, or really anything else that we ask about. I don't have the question on me right now, but it really didn't play out in the data like we thought it might have, in terms of age being an influencing factor, you know, adopting technologies within the practice.
Yeah, I would add to that we also asked all of our respondents on a scale of 1 to 5 to give us a sense of their desire and willingness and interest in using technology, and across the board with no difference for any sort of size of practice or location or demographic or age. It was very, it was basically, I think it was about 4.5 on a scale of 5, which is a very, if you compare it to many other areas, it's a pretty high score. So I think this speaks to the fact that when the technology is useful and the technology is appropriate, it really isn't age or any of those other things that people would typically think of as a factor. In this case, certainly, we did not see that.
Yeah, there's some good questions coming in, and I think before we move on, this might be a good time. I mean, there's 800 respondents. I don't know how many questions were in your survey. I mean, you have a treasure trove of data. You have lots of different ways to kind of look at this. So I don't know, Garrison, when you look at this as someone who's kind of lived inside the data set and tried to pull out the common themes and really examine it, is there anything that really stood out to you around the general data set from telemedicine standpoint, from the pediatricians, the 800 pediatricians that you had responses from?
Yeah, I think the data can only go so far in like truly understanding where the clinicians that responded are at in regards to telemedicine. And that's why we included some of those write-in comments, because they really provide more context and clarity to, how clinicians feel about telemedicine. And to me, the thing that really stood out in the data and the write-in comments was the fact that it's not, telemedicine is not just a video visit. There's such a huge aspect of creating efficiency in the telemedicine initiative within the practice through, just like training on the platform, support, and then like we had mentioned, having, dedicated clinicians on certain days doing it. All those factors around efficiency just kept coming up. And the fact that it's not just, a video connection, you're not just looking at your patient on a computer screen. There's so much more that goes into it, and a lot of planning that needs to be done ahead of time to make sure it's not interfering with the other workflows in the practice. And that's really what stood out to me in the data and the write-in comments.
Yeah, that's great. And it's pretty interesting. I was doing a presentation for an AAP ECHO program in California last night, and what you just stated was pretty much resonating with everybody around the questions. I think a year ago it was grab whatever I can, kind of do video. I think this is going to be easy, and it seems like I guess the comment last night seems like the more we learn, the more we realize we have to learn more. Right? That this is kind of if it's going to be part of our practice, how do we really integrate it into our practice? When do we use it? When don't we use it? Certainly right now, I think all of us, the theme last night was we just want to see our patients, give them a hug, give them a high five, kind of get out of the COVID mode. But we also see, certainly they want telemedicine and telehealth. Certainly right now, some of them just want to come in and see us. But kind of that workflow is starting to bubble up of, hey, maybe this isn't solved yet for us or our practice. So it's interesting that kind of, sounds like that theme kind of resonated for you.
Yeah, definitely.
Marian, how about you? You guys have been into this for a while. Are there things that kind of really stood out from you that you see as common themes? Or
yeah, well, if I may, I'd like to answer the question a little bit differently. So as the person who's outside of somewhat outside of the industry, or so we say adjacent to the industry, and sort of entrusted with looking at this through an independent lens, the 30,000-foot view, if you will, what I find really interesting, but also reassuring, not just for the pediatrics industry, but also for telehealth, is that I would characterize pediatricians as essentially having one foot in the door of the telemedicine room, and one foot is either still outside or somewhere on the threshold, right? So most of the people we heard from are motivated. They want to use technology. And most of them who are not already fully engaging with it certainly told us that they would enter both feet fully into the room with telemedicine if number one, most important, and I'm really reassured by this, if their patients are happy, if their patients are demanding it, if their patients are feeding back that it's working for them. So that's number one. Second thing, we've talked a lot about EMR integrations and making it feel seamlessly more like mimicking in-office visits and really offering true virtual care. Having the ability to work with the things that are really important in terms of peripheral devices. We've talked about the consistent insurance reimbursement. So this is how I characterize this group of people, is that if you give me those things, in fact, if you give me perhaps 2 or 3 of those things, I'm perfectly willing to walk fully into the telemedicine room, which I think is really reassuring both for clinicians, it's reassuring for patients and the world at large, because telemedicine isn't going away. And obviously for people like yourself, Mick, who are a provider. I think the other thing that is a takeaway for me is the people who are using it and using it fairly extensively, their feedback certainly is that it's working. It may not be perfect, but it's working. It's working for them, it's working for their patients, it's working for their clinical practice. For the ones that are not using it as often, or perhaps to its full capacity, like they are only scheduling visits during regular office hours, not on weekends or after hours or whatever, they are seeing the opportunity and they're willing to engage with the topic and perhaps see the opportunity. So that kind of sums up what I see at a pretty high level with this audience that we talk to.
Yeah, so Marian, when you think about patients versus the clinicians, the pediatricians, it sounds like the patients are the one that are really the driver, and we're still we're farther along with pediatricians, but for the most part, there's still a split in kind of toe in and toe out of the water of telemedicine, you would say?
Yeah, and I think this comes back a little bit to this particular specialty area. You know, when you have parents and the patient, and there's a level of complexity and all kinds of layers that go on here. I think pediatricians are uniquely and very focused on making sure that all of their constituents are happy with this. And I think when that starts to prove itself, you will see a stronger and faster and more complete adoption of all the ways in which telemedicine can serve the clinician.
Yeah, it's great. No, I appreciate that. You know, I think it's certainly interesting to see the evolution of attitudes and opinions, and certainly anytime with technology, there's, you know, the early adopters, the late adopters, and there's the no way adopters. And certainly last March, everybody had to be an adopter in one way or the other. So it's interesting to see the ongoing evolution, because I think, like technology, I think the evolution of the adoption will continue, and it'll continue to evolve. So it's pretty interesting to see. So great stuff. And you know, the other part of the study, I mean, is we certainly asked which platform folks were on, and we're very interested from an Anytime Pediatric standpoint, because it's often a question we get is how are Anytime pediatricians different than others, or how are things different? So we thought we'd present today too some differences. Again, this is from a non-biased study and a pediatric specific kind of questionnaire that went broadly. So we thought we'd pull out a few of these data elements that were pretty interesting. You know, I think the first thing is that the Anytime Pediatrics folks were those folks that were more likely to do more of the virtual walk-ins and not, you know, certainly scheduled visits, kind of an instant visit or a virtual walk-in. So they were the ones that kind of expanded that time and that access. And clearly they would, you know, look towards a platform that had more of those capabilities as opposed to just the scheduled visit. So not surprising there, certainly to us, and it'll be interesting to see as time goes on, you know, with only, I think Garrison reported, 29% of that you know, are doing that second level triage. So I think the after hours and I think the weekends was a small number as well. So, you know, a real opportunity with telemedicine is expanding access. So it'll be interesting to see how that kind of goes forward. Go to the next slide. So you know, from the big picture, these were kind of, I think some of the themes were integration focused was important, but, you know, really high demand for peripheral devices, certainly more likely to utilize technology. They were the folks that were not only doing the EHR and telemedicine, but were certainly more progressive in doing the automated scheduling and bill pay. They reported more visits per week than other users. Not surprising, again, since, you know, they typically offered a little more access, and they were more focused on the patient experience, probably more than patient experience, probably patient engagement. So I think we have some data on that in the next slides if we want to kind of go through that. So I think the other thing is, they really felt like support was important. And again, that's a key piece of kind of what we offer, but the support of the Anytime Pediatric users was certainly higher than other platforms. And some people, you could say don't need support or don't want the support, but certainly, adding that support in, as Garrison suggested, of being able to, get help for your parents or your clinicians and help with technology or other things around telemedicine is certainly broader than just, what's my connectivity or what am I doing there? So again, getting down into some of the details, really, peripheral device integrations was a predominant ask for folks on the Anytime platform, translation services, application to chronic care, and remote patient monitoring were really similar across populations. So it's pretty interesting to see. So I think the peripheral device thing was interesting. So these are certainly folks that want more than just a video visit. They want us to add otoscopes and peripheral devices, stethoscopes and the like, and kind of seeing this kind of moving forward. So that we thought that was pretty interesting.
Yeah, and I would kind of add to that that I think that goes along with the difference we saw with AP customers in terms of the sick visits. The most common use case for Anytime Pediatrics users was a sick visit. At around 77% reported that as the most common visit type via telemedicine. So it kind of goes hand in hand with kind of enhancing that sick visit experience and making it more like the in-person visit that I had mentioned earlier.
Yeah, that's great. Patient demand, I think it's true across both all customers, so non-AP and AP customers. Insurance, opportunity to grow the revenue was a little more on the Anytime side, which I think again it all kind of lines up with the type of customers that are looking to kind of expand access, make sure their patients aren't going elsewhere, offer those virtual walk-in visits and do the like. So both revenue and lessening patient leakage really kind of stood out as predominant things among Anytime users. Next slide. So, and this is what Garrison's talking about, is that, sick visits was actually the biggest in the Anytime, as well as behavioral health. I mean, overall on the platform, about 55% of our visits are behavioral health, which isn't surprising. I think we can all get our heads wrapped around it, what we can do for mental health and behavioral health, certainly via telemedicine. Surprised about the sick visit because especially with so many sick visits going away, as we all know that, we're not seeing RSV and flu and other things in the time of the pandemic with social distancing. So I see this as kind of the next generation as we move into kind of virtual care 2.0, is how do we use triage and manage sick visits, and do we add in peripheral devices or try to help more after hours on weekends or those kind of things. So not surprising, med refills are pretty similar, follow-up visits pretty similar, in behavioral health were pretty similar. Sick visits was the biggest difference, which again would surprise you depending on how you want to use your telemedicine platform. Next slide. So at this time, I think, I want to thank Garrison and Marian, and certainly we're open to questions. This was probably one of the hardest webinars we've done, especially from Marian and Garrison's point, but just because they have a treasure trove of data, and really trying to pick out the common themes and the incredible number of write-ins. Garrison has spent a lot of time in there in looking at the write-in part of it, because it was a very engaged population. So there's a lot of good pieces of the puzzle there. And I know, Tencel, you're going to share an ability to download the overall white paper report on the study, right?
Absolutely. Yeah, I'll share that with everyone in the chat. We also have a couple of questions coming in, so would love to open it up for anyone to use the chat or the Q&A portal to ask some questions in this last 15 minutes or so to our panelists. We do have a couple of already that have come in, and I'm not sure that we have data points specifically. One kind of just comment from Dr. Hines, who we know is an Anytime user, is he finds it easier to use the phone app to talk to patients while documenting within the EMR. on the computer. So he does, the survey kind of indicated that clinicians perceive that patients prefer the mobile app over the web version, and that clinicians prefer the web version over the app, but he is saying he's providing some kind of insight on how the mobile app might be more beneficial for clinicians as well. And I don't know that we have data on these two pieces, but Dr. Connors might be able to speak to what role are you seeing malpractice with the relationship to virtual visits?
Yeah, I think that's a great question. And certainly something that we commonly see across the board is, concern about risk. So as I've looked at this, when I came at this 4 years ago and worked with Dr. Schmidt, we certainly looked at telephone triage and the risk related to telephone medicine. And I can speak for myself. I mean, I think in our discussions with him as well, the ability to see the patient, see the parent, see the environment, be able to get more data, more elements, more information is certainly additive, I think, to visit, the ability to triage, the ability to see patients and lessen the malpractice risk. And I think overall for us in pediatrics, we certainly, we do telephone work, we do things via video, we do things in the office. And each time we kind of hit that area where we say, gosh, I'm just not comfortable, or I can't see what I need to see, or I'm worried that there's something else going on and I need to see you. So I think one of the most important things around malpractice is 1, relationships, 2 is empathy, and 3 is kind of knowing your limits. So I don't think anybody, in this survey, if we ask them, would telemedicine replace all in-person visits and do away with hands-on care? I think would be a 0 out of 800, myself included. So I think around malpractice, all those things are really important. And then the other malpractice question that I don't have an answer to, but it's certainly a gray area, is as you cross state lines and your patients cross state lines. So I think we all provide telephone care across state lines, but there's certainly a little more gray area. And what we tell folks is to really check with their malpractice carrier if you're going to live in a cross state lines with your patients. So hopefully that helps.
Yeah, and I know maybe in the last 6 months to 12 months or so, hybrid visits, so setting up a tent in the parking lot or drive-through visits in combination with the telehealth visit has been a popular option. So we have this question, any questions or data about the hybrid visits for health supervision visits, doing history and screenings through telemedicine and exam and immunizations in person?
Yeah, Marian, was that a specific question, or Garrison, did we have any specific questions around what folks were offering from a hybrid perspective? So, again, like the questioner asks, is, anything around hybrid visits?
No, we didn't ask it specifically that way. What the only thing that is related to this was we got quite a number of write-ins about people who were using it. I would characterize it, you used a word earlier, Dr. Connors, which is triage. So this idea that they're using it to screen, to find out exactly what needs to be done, helping them keep patients out of the ER, helping them understand what needs to be done and is there a need for an in-person or follow-up visit, but not specific. We didn't specifically address hybrid visits in this form, if I understand. I think it's Jennifer Zubler who asked the question specifically.
Yeah. Go ahead, Garrison.
We didn't address that question specifically, but again, it kind of came up in the write-in comments of how some of the respondents were utilizing it as a triage mechanism to kind of determine next steps for care for patients. So it kind of came up just through the write-in comments again that way.
Yeah, and I think some are seeing the ability to do hybrid visits in the sense of, hey, can I do anticipatory guidance, CHADA screening, behavioral health checks, vision, hearing, can I do those outside of the office, before they come in for their visits? So I think we'll see more of that from a hybrid perspective. I think all of us in pediatrics, and certainly for the annual physical and exam, would, I was amazed in April and May, we were talking about doing virtual well care, but I think as it falls out, we'll probably do some of that virtually, but certainly bring the patient in for immunizations and, the complete physical exam that they need. A couple other questions have popped in here, and, here's one. So payment, Marian, you said was an issue, and yet right now most pediatricians are getting paid, if not all pediatricians are getting paid for these visits. Were you able to tease out why there was still hesitancy around payment, or what the payment issue was? Was it eventually it'll go away, or I'm not sure I can dive in because it might go away, or Were you able to tease that out in the data?
Well, what came through is that it is an issue. It's considered an issue. And when we asked the question a number of different ways, and what certainly came through to us is the fact that while we can say that that reimbursement is happening, it appears to be quite inconsistent. So first of all, on obviously a insurer by insurer basis or a state by state basis or even a type of visit basis, we had a few write-in comments were like, well, we don't get fully reimbursed for X. So I don't think it's as much of it as an issue of the fact that is it or is it not being reimbursed? It's a question of the degree to which and the consistency with which it's being reimbursed. Is it being reimbursed as quickly? We had a couple of people write in and say it doesn't happen as quickly, it doesn't happen as thoroughly. So it really is, it's not consistent. And I think that's leading to a perception of some clinicians saying, not so much that it's not being done, I just can't count on it, I guess is the way I would characterize it.
Okay. Yeah, and I think the other question that I'll throw out was my question when I saw your data was pretty interesting that 92% of pediatricians kind of feel that this is a patient expectation, and yet I think I heard you say that they would want like more patient demand that would drive them to use it more. So do they need more than 92%, or where do you think the disconnect is there between 92% of patients want it, but if patients would only demand it more, I'd use it more? Where am I missing out on kind of what you guys found?
Yeah, I don't think it's a question of whether we're missing out. I think it's really the difference between what people see as kind of being a standard now, right? So a year and a half ago, adoption was certainly much lower in the pediatric practice of telehealth. And then came the pandemic, and a lot of people were essentially forced into using it, even if they didn't want to, or forced into adopting it more in a more robust way, even if they weren't comfortable or they didn't feel fully trained, or not all the clinicians in the practice were using it. So there is now this sense that a year, and we did this in January, so a little bit less than a year into the pandemic, that it's kind of an expectation. It's here to stay, and patients are expecting it to stay. And at the same time, the real question, I guess, for me that bubbles up through the data and the write-in comments is this sense that, I believe I mentioned this earlier, that pediatricians, nevertheless, expectation is one thing, but they want to know that their patients are comfortable with it. They want to know that their patients, parents and the kids are comfortable with it, that they're using it, that it feels more like virtual care, that it mimics an in-office visit more closely. And I think that it's not so much an inconsistency or a disconnect, but it's almost like physicians are saying, I now need the proof point of my patient population telling me, even though they know it's here to stay, they like it. They want it. They want me to use it. And then I will engage with it more thoroughly.
Yeah, very interesting. Yeah, we're getting a couple other questions. So one question was around the use of TidoCare for patients to use at home during the encounter. I don't think we got any data specific to what type of devices folks wanted. I know that the feedback that we've gotten around peripheral devices is just the expense, and what's one of the challenges, especially, looking at it, I think TidoCare is $299 for the kit. So I don't know if there was any write-ins, Garrison, that you saw around TidoCare, around peripheral devices, or success or failure with those. Did you see anything from the data?
Yeah, it did not appear that any of the respondents currently were using peripheral devices, and there was no reference to specific peripheral device providers such as TidoCare, but there definitely was, like in one of the comments that we showed, like a need for the otoscopes and stethoscopes, just from a pretty general kind of perspective, but no specifics really.
Yes, I think it'll be interesting as the price comes down, and we're certainly as a company working on those kind of devices in a lower cost way, and really trying to sort through. I think the biggest fear we all have is, can patients utilize them, and can they be pretty straightforward and easy to use? So connecting to if they struggle with connectivity, and then you adding a Wi-Fi device that they need to connect, and then be able to find an ear and things like that, there is some questions around how do we really drive good utilization and getting great pictures and expanding the device. So I think a pulse oximeter, stethoscope, and otoscopes are coming, and I think the prices are coming down, which will help expand. I think especially for the families that can't travel to the office, or it's a transportation issue, or it's distant, or those kind of things. We'll see more and more of that kind of coming down the pipeline.
We did have another question come in about hours for visits. So what's the difference between an instant and a virtual walk-in? Are they both considered on-demand care?
Yeah, I think, well, within our platform, there's a couple of differences that you can use it for. So the virtual walk-in, a patient can literally, we see it as where we're trying to progress is kind of the virtual front door, right? So we see telemedicine as kind of moving, during the pandemic, it was 100%, to the clinician and the pediatrician. Where we see the future is, being able to interact with the front desk, being able to interact with the nurse, maybe do nurse triage, and then move it on to a physician, kind of mimic that in-person workflow. So with a virtual walk-in, you set your hours and determine that you're available, and a patient of yours can literally walk in. We do have virtual urgent cares too that will offer walk-in hours. So you can kind of open your office during lunchtime. We have some that do it before breakfast or before the office opens, while the kids are waking up with fevers, and then some that do it after hours and on weekends. So that's more of the virtual walk-in. It's kind of setting those hours, allowing them, I think of it literally like you can literally knock on the door and interact with the practice and see if you can get a visit, or they can schedule you for a later visit. The instant invite in our platform is the ability for the office to go in the reverse direction and say to a family, hey, I'm talking to you on the phone. Looks like you need a telemedicine visit, and we can kind of instantly invite you and kind of get you in. And then the third option is the traditional scheduled visit. So the patient calls in, goes through the phone tree, sets up an appointment, gets scheduled, gets reminders, and those kind of things. So some of that flexibility, I think we'll see kind of going forward as folks are trying to integrate this into their workflows. And I really think that the future is going to be, kind of telemedicine isn't just for clinicians. I think it's going to be part of what we do, kind of mimicking that in-person visit where you could interact with the front desk, you could bring in a translator, you can add a nurse, you can then move it on to a clinician. You can add a clinician from the office if you want to do a consultation. Those kind of things, I think it's kind of how we see the future going. And I think from what we hear from our pediatricians when we don't do formal surveys, but it's kind of that ability for folks to overcome some of the connectivity, do some technology training. But if a patient has an issue, how do we overcome that? Because, I think there's a lot that we can add with the video. So we hate to see folks default to, a telephone visit, because I think there's certainly times you can get by with that telephone call, but there are times that you need a video. There are times you need to bring them into the office. There's time in the office that you need to set them on to the urgent care and the emergency department. So it's kind of, how do we get back to that continuum of care and having patients reach out to the medical home first, making it accessible and making it easy, which, makes better care for patients, keeps patients in the medical home. And I think kind of drives that care continuum is how we think about it.
And do you see that most pediatricians and pediatric clinicians are offering telemedicine as an option when scheduling?
I think what we've learned over the last year, and Garrison and Marian, I don't know if you found anything in this data, but I think if we've learned anything in the last year with all the changes, is that if you've seen one pediatric practice, you've seen one pediatric practice, and if you've seen one pediatrician, you've seen one pediatrician. So we see a wide variation of who is doing what and how and when and how it fits into their workflow with their patient population. And I think we all have our biases. That's why I was excited to have Health Mavens do this study. So and really, I haven't had a deep dive myself into the data or tried to influence the data in any way and their interpretation of the data, because to me, it's we're all biased, right? Some of us come into this like we hate technology, we hate telemedicine. Others say, hey, telemedicine's the best, and others are kind of in the middle and still trying to figure it out. So I think everyone is still figuring it out, and I think I can tell you from my personal experience 4 years ago when I got into this crazy world of telemedicine, I kind of got laughed at because they said, well, those on-demand folks have already figured it out. There's really nothing to figure out. You're way behind. And I think if COVID has taught us anything is we're actually just at the beginning. We're all just we're all figuring this out and sorting it out and driving best practice and moving things forward together. Because there's, I can tell you, we've got a list of 100 feature functions that pediatricians want in our platform that we're trying to frantically kind of get in so that we can continually improve the process, the flow, the workflows, and the connections. So I think this is far from done. I think we're just at the beginning. I think it's here to stay. But, in the end, it's trying to drive best practice and recognizing that, variation is part of the art of medicine. So the more we can share and identify what's working is really going to be helpful.